Witkowski is an OBGYN, and he has just been awarded as a fellow of the American College of Lifestyle Medicine, which you're one of the first to do that, which is pretty exceptional.
Yep.
We're so lucky to have you with us here, but can you tell us a little bit about your practice and why you chose nutraMetrix?
Sure. Well, 2 years after my father died, I found his wallet. This is his wallet. You can see there's his Harvard ID card because he worked at Harvard University. You can see that he has his MasterCard still in here.
He just lost American Express.
And his Tufts Health card. But most importantly, when I opened his wallet, Marty, I found this piece of paper. And on this piece of paper, there was a list of medications that my father was taking. That list is 17 medications long. That hit me right between the eyes. Lantus, Indor, Cardizem, Lopressor, Simvastatin, Clonidine, Lasix, Plavix, Allopurinol, Elavil, Combivent, Tylenol he used to take, vitamin D, Ecotrin, Questrin. 17 long. "15 years before my father died, he had quintuple bypass surgery. If anyone doesn't know what that is, that's when they take an electric saw, they cut your sternum open it up, so that they can harvest a vein from your leg and go by the blocked blood vessels in your heart. 2 years before my father died, he had his leg amputated just below the knee from complications of diabetes, because he was a diabetic. The interesting thing is, none of his doctors asked my father about his lifestyle, asked him about nutrition, asked him about what his goals were in 15 years, 20 years, when he had this done. And here I am. I'm the son of the doctor. I should know. I went to a great medical school, Tufts Medical School in Boston, Massachusetts, and in Tufts, we had one of the greatest, thank you, Boston. We had one of the greatest nutrition trainings. We had 21 hours of nutrition training in 4 years of medical school. And even through my residency, never talked about lifestyle. So with this, it was the perfect storm. My patients were asking me, why am I getting put on medications? My patients were gaining weight, and they were coming to me for answers, and I had nothing to give them. So it hit my family, it was hitting my patients, and I had to go on a journey. I had to find something else that I signed up for, because this isn't what I signed up for. I really wanted to make a difference. I wanted to help people. But it didn't make a difference what I was trained. So I dragged my wife, Pamela, all over the country. We went to all kinds of conferences. I didn't know if it was integrative medicine. I didn't know if it was functional medicine, alternative medicine. I didn't know what it was. But then I found lifestyle medicine in the American College of Lifestyle Medicine. And lifestyle medicine is where we use evidence-based lifestyle interventions so that we can prevent and even reverse or treat lifestyle problems. Chronic diseases that are killing over 85% of all Americans. Cardiovascular disease, diabetes, cancer, and obesity. Those four kill 85% of everybody in this country. Then a friend of mine sent a nutraMetrix consultant to my office, Kathy Kaufman. I don't know if she's still here today, but Kathy Kaufman, a well-trained nutraMetrix consultant, came to my office. But I didn't have time for her. I'm a busy obstetrician gynecologist. So I canceled, and she came back. And I canceled, and she came back. It was 4 appointments that I canceled on her, and she kept coming back. Her persistence was phenomenal. So I gave her the time, and I started to listen to her. And she started talking about custom wellness solutions and residual income. And my wife and I were like, yeah, I would love to have some residual income. It's something we're thinking about anyway. And so Kathy said, if you come along with our program, I can teach you these things. So I had 3 questions for her. I said, will you be able to train me on the ingredients? Because that was important to me as a doctor. I had to know what I was giving my patients. I couldn't just give them anything. I had to know. It was my responsibility. I asked her too, can I try them? And sure enough, she had something in her bag that she was able to give me, and I tried them, and I liked them. I thought they tasted great. And then I said to her, well, Kathy, is this one of those companies where you got to go to a lot of meetings, and then you got to go to these big, huge conventions with a lot of rah-rah? And Kathy said to me, like every good trained nutraMetrix consultant, she answered the question with a question. She said, do you like rah-rah? And I said, hell yeah, I love rah-rah. So you never know. You never know. Keep an open mind when you walk into the office, because you can't prejudge that doctor. He might be busy, but keep going after him, because you, just like JR says, you can't say the wrong thing to the right person. And that's what I would do. And then, as I went to some of the trainings, and I can tell you I went to 7 trainings for nutraMetrix to learn about their products and learn about their ingredients, I really found this company fit very well into what lifestyle medicine is all about helping prevent and even help conditions that everybody in this country is dying from, like my father, and like a lot of patients of mine. So I don't think there's a better time right now with the push, with the wave of lifestyle medicine now sweeping across the country. Yes, it started in California and Portland, Oregon, but it's also coming east to Boston. And I see it every single day. More and more doctors are more interested now in helping prevent these chronic diseases, because we're starting to understand that's where medicine is. That's where we should be treating patients.
Awesome.
Thank you.
Thank you. Thank you. Now, Dr. Rosa is a chiropractor with a very busy practice, 14 clinics, very, very busy practice. You mentioned to me that something happened to you this weekend. A project that you're working on called you away from the convention for a little bit. And when you shared the story with me, I just thought we had to share it with everybody. Can you tell them kind of what happened when you got here on Wednesday and what you did Thursday morning and why you're here now?
Yeah. Everyone realizes that we're in the middle of the opioid crisis right now. You can't turn on a television without seeing it. How many people in here know somebody, family, coworker, or friend that's affected by the opioid crisis? Well, the day before Wednesday, they declared it an official, not state of emergency, but a national emergency. The Trump administration said, that's it, it's too big of a crisis, we're going to throw ourselves at it. Well, I'm on the task force in Washington, and I get the call because I've been dealing with the opioid crisis for over a year now. Out of the 14 clinics, 4 of them are in a medical practice, deliberately trying to change into integrative medicine, whether it's physical therapy, chiropractic, acupuncture, yoga therapy, mindfulness, you name it. And we've already done a few white papers and the rest. But in the clinics, I have all these products, so I've been able to use that and to integrate it into the system. But they asked me to come and speak on Friday morning. So when you get that call, and you're already on your way here, I came Wednesday with my brother, and Thursday night, I did Wednesday evening, was here for the introduction, got Thursday done. Thursday night, I got on a plane, went to Washington, D.C., did my lecture, took about 2 to 3 hours, got right back on a plane because I believe in you two. Now, I don't know if it's like commitment or I should be committed because that was an insane trip. And then staying up at 3 in the morning with the rest of you guys almost every night. I said to Marty, we were backstage, I said, we need to come up with nutraMetrix nap. It's like, and I don't know how you guys do it because you were there later than I was last night. So there's a couple of issues right now with this crisis. You have an initial stage problem where people are going in to a doctor's office for a sprained ankle. They're getting 30 days of Vicodin, Percocet, whatever that may be, and they don't get off of it. It's not a good option. 20% of the population are drug addicts, and they'll sniff glue or find a pill. That's not who we're talking about. 20% is what the drugs were made for. Cancer patients, crush injuries, multiple surgeries, people who actually need it, because they do help when needed. 60%, the chunk that's in between, are people who are getting placed on these medications that never should have been placed on them. And they're dying. So 80% of the deaths are related to somebody who received a prescription for this medication. 80% of those deaths. We skyrocketed from 1991 when the Follow the Money Trail, the drug company, said it's the next vital sign. If you take blood pressure in an office for your patient and you don't have those little smiley faces or frowny faces and get a pain scale done, you're not doing your job. So from 1991 on, we had an enormous spike of usage of these opioid products, because you would go in for an ear infection and they'd say, well, you have any pain? Well, yeah, my back's killing me. I woke up tight this morning. Here, take this medication. 124 people die every single day. We've lost more people this year than in all of Vietnam War. So in the clinic that I'm in, 4 of mine are in medical practices. In all my clinics, I'm using these products to give, we all know, I don't have to go through protocols of what kind of, we have anti-inflammatory, we have stuff that helps with pain, we have the D, we have the omega-3s, and we could talk all day about protocols. We have them. So if they get hurt, I want that soccer player who twisted his ankle to get ibuprofen for inflammation and come to me so I can start treating them and get them on some product. That's problem one. Problem two is now you have these people who are addicted, not by their own fault, and they need to get off of the medication, and doctors are getting handcuffed. I mean, we had this conversation while we were sitting down. Everybody's getting handcuffed because now they're saying you can't write anything. Well, what about these people that have been taking it for 7 years and have no, it's personal for me, it's personal for everybody. My sister-in-law, my brother Peter, who's here, and all three brothers from Sicily, we should open a pizzeria, we're all involved in the business. But she had, a life-threatening accident, crush injury, and she was put on the meds and addicted, and it took my brother a long time to get that process done. And the minute he started putting her on those products, she was like, I don't have to take half of these meds anymore. Now, if that's not personal, that's a big deal. And that's when I started, because that was about a year and a half ago. So in my head, I'm like, I didn't even think of putting this 2 and 2 together.
Right.
And there's an interesting process with that second pill. I don't want to just eye me to say if I'm talking too much, because I get verbal diarrhea. The secondary piece to this on the addicted piece, you can't say you're going to walk in and knock on a doctor's door and say, take them off the drugs, I have a replacement. That's insanity. Right. You're not going to get anywhere with that. But you tell them that you have a tool that you could give them. They are dying right now. They're asking every single day, you're telling me not to write the prescription. What am I supposed to do with the patient when they're in my office? Right. Well, integrative medicine is an alternative, and part of that is the nutritional piece. When I put it through, I do doses in small amounts. Sugar, Cornell University did a study, cocaine, sugar. The dopamine response from sugar was higher than that of cocaine. That's why we're all walking around with nice bellies, because we're addicted to sugar, we don't even know it. But let's flip it around with what we have. Our stuff is, you have to take it. It's something you physically have to take. So a lot of mental illness comes in here where people don't even have pain anymore, but they're so used to taking something that they think they got to take it. So with the people that are on the drugs for a very long time and they're being weaned off, I give them something every 2 hours. Every 2 hours you need to take this. And bromelain, we have the OPC, we have bromelain, we have products that we could mix and match. But that little sugar, and it's not a lot of sugar, but that little bit is a softening. It's just a little padding on that problem.
Right.
And I've seen results. I've seen it. Now, I'm going to go full circle with why I'm having this conversation. Why? You see, I'm passionate about it. It makes me crazy. I'm on a task force for a reason. Now, I want everybody who know. I don't. If you're an NC or a practitioner or not an NC, you better be one. Don't be afraid to knock on the door and talk about this new little tool that you have. It's not a replacement for drugs. It's an assistance to get better. Thank you, guys.
Thank you so much.